My name is Katrin Põld. I'm the current president of the Estonian Sleep Medicine Association. I'm a neurologist by training, and I'm a member of Estonian Sleep Medicine Association since 2014. And I'm very excited to be the president of the ASMA for the next 3 years. So the Estonian Sleep Medicine Association has a long history, well, relatively. It has been founded in 2005 by a company of neurologists, pulmonologists, psychiatrists, ENT doctors. So it has been a relatively multidisciplinary team from the start, and it had gained, well, not popularity maybe, but the Sleep Medicine Association in Estonia has been very active from the start. And so I'm very honored to be in this position. And a lot of work has already been done by the previous presidents, including the initiatives to host several sleep meetings in Estonia. We have been very lucky to host the ESRS Sleep Congress in 2014. We have been lucky to be part of the Nordic countries sleep medicine initiative and to participate biannually in the Nordic sleep conferences, and also the Nordic sleep medicine conference was held in Estonia in 2017. So what we have been up to in the recent years, since 2019, we have been trying to strengthen the ties between Baltic countries, Estonia, Latvia and Lithuania, in order to promote better cooperation on sleep medicine and sleep science also. And since these countries have a relatively small and relatively homogeneous population, so there have been initiatives and incentives to promote networking, shared databases, shared scientific research maybe. And we have been fortunate to have held already 2 Baltic sleep meetings. The first one was in Tallinn in 2019, and the second one was held in September in Kaunas in Lithuania. So this is one initiative that we were looking forward to strengthen to. Another thing was to start our own set of national guidelines. The first of them was Estonian National Guideline on diagnostics of sleep disorders and sleep-related disorders in primary care. It was published by Estonian Sleep Medicine Association and Estonian Health Insurance Fund, which was funding this initiative. It was published in 2019, and this is mostly useful for primary care physicians, primary care nurses, practitioners who deal with sleep patients, in order to promote better understanding of sleep disorders and how to manage the patient and when to refer the patient to sleep specialists. There are not very many sleep centers in Estonia, and this guideline has proven very helpful. And our next steps will be to make a task force or group of experts to maybe also with help of Estonian Health Insurance Fund to publish some kind of national guidelines on sleep disorders treatment, because this is a thing that we're currently lacking. And of course, we're looking forward to participation in we're actually already participating, but to further cooperation with the Sleep Revolution project, which we're already part of. Yeah, so these are the main points. Well, actually, yeah, I haven't been really involved in this process. It's mainly run by, or actually the initiative from Estonian side has come mainly from Dr. Triin Jaagomägi, our orthodontist and member of Estonian Sleep Medicine Association board right now. So she has been very active in maintaining the relationship with Icelandic colleagues and it was her initiative actually for Estonia to take part in this project, and we have been able to send one of our sleep technicians, member of Estonian Sleep Medicine Association, Tiina Siinok, to Iceland to participate in the data collection and interpretation in the project part regarding sleep disorder breathing and polysomnographic studies. So this is I can say that much about the participation of Estonia right now. Well, the status of accreditation of sleep experts is a somewhat more complicated issue. It's been a topic of debate of whether we should give accreditation from Sleep Estonia and the Medicine Association ourselves, or should we stay with the current procedure where persons who wish to become ESRS certified experts perform the examination in sleep medicine, which is usually held during the European sleep conferences. And this has been actually the only procedure in Estonia so far. So we have not accredited sleep specialists ourselves because the sleep medicine is unfortunately not a subspecialty. It's not a recognized medical subspecialty currently in Estonia. We're certainly working with the University of Tartu on that. So since I'm a medical doctor myself, when I was a student still and a resident, I was kind of surprised on how little sleep medicine was taught in the university and in residency programs. So it was approximately 4 hours of sleep medicine, mainly regarding insomnia. Actually, yeah, that's the problem. Since there is only one, medical university in Estonia, and the lecturers in sleep medicine are really few, and they're mostly active practicing physicians. So it's kind of difficult to organize a formal education. And that's why most of the courses on sleep medicine have been either optional or sort of extracurricular activities, which is really sad because this is sleep disorders are such a widespread problem in our, and it's a common cause of patient visits, I think, to doctors of all specialties. So it's most doctors who are willing to be active in sleep medicine and most nurses are actually in current situation have to somehow make their own program to acquire knowledge in sleep medicine, or have to go abroad to study sleep medicine. So that's we are looking forward to it, and we're trying to make educational courses to residents, to junior doctors in training, to make some kind of teaching courses and lectures on sleep medicine, just to incorporate it more formally in their education process. It's not only in doctors who are currently in training, not only to residents, but we're also constantly trying to update the knowledge of general practitioners also, who is actually our main target group and who are also the main target group of our sleep disorder diagnostics guideline. So this is an initiative we're also trying to keep going and trying to expand our focus also to include nurses, especially the ones working with GPs or family doctors, because they're often the first ones to contact the patient. Well, most of the patients actually come to the doctor's office with relatively non-specific complaints. And that's where the tricky part begins, where we made the guideline, because most of the patients, of course, do not present their complaints by the book. Most of them will tell you that they can't sleep, or that their sleep is of insufficient quality or quantity. And that's when the tricky part begins, just to just to find something out of these complaints, you need to invest time and you need to counsel the patient. You need to make him or her just to keep the sleep diary or something like that. And that's when the role of the nurses becomes very important, since they will be mostly the ones consulting the patients. Most of the problems, of course, tend to be self-limiting, especially regarding insomnia patients or things like that. But of course, some of the most complicated patients can also present to you that way. And unfortunately, due to funding restrictions, due to poor availability of polysomnographic studies, some of the patients with more complicated problems, especially hypersomnia problems, narcolepsy, and things like that, they tend to go undiagnosed and untreated or undertreated for months and years, maybe before the correct diagnosis can be established and the right treatment can be started. I think it's actually a pretty common problem, not only in Estonia, but also in the Baltic countries and in the Nordic countries also, perhaps. I think it's a very good question, and I actually see our purpose as a medical society also not only to educate our fellow colleague doctors and nurses, but also to actually educate the public on the importance of sleep and sleep disorders, and also to somehow start a dialogue with the universities, with medical schools, policymakers also, to gain more attention to the problems of the costs actually and the societal burden of sleep disorders on our society. Actually, the population of Estonia is only 1.3 million, and each year we have pretty terrible accidents due to people who drive while sleepy and so on. So we actually can't afford to lose people during these disorders, which are treatable actually. So this is our purpose, and of course, which was already mentioned. So we're trying to somehow integrate the educational programs on sleep disorders already in the university curricula and in the residency programs, which is of course still problematic, because if it remains optional and not mandatory, so there is still very limited access to the more wide audience. So this is still a problem. Yes, what Latvian colleagues are trying to establish. I heard about it in Baltic Sleep Medicine Conference, and it was very refreshing to see also young and active people on their side speaking about the same problems that we have. So we have pretty much in common in terms of lack of awareness of sleep medicine as such in the society, in the reimbursement companies, in the policymakers. So we're dealing with pretty much similar problems in all of the Baltic countries here, yes. The members of the sleep societies in the Baltic countries regularly publish various articles in popular social media, speak about it on television and on the radio and so on. And also quite regularly, various conferences are also held on sleep-themed topics, which are meant for the more broader public, not only to medical professionals. So yes, I think this is a way to reach the general population. Yes. I'd like to congratulate the ESRS on the great textbook, and so keep up the good work and good luck.